Hi, this is Bob Sidelli. This is a short lesson on orders, order sets, pathways, and your role play workshop. We'll be talking about these components that will be used in the workshop and a very short description of the rounds. The objective at the end of this short lesson is that you'd be able to read a clinical pathway and begin to understand how and why they were developed at NYP. Orders. So what are orders? Pretty much any action in healthcare is based on a diagnostic or therapeutic plan. To get these things started, other than the actual surgery, you need an order, whether these are taking vital signs or performing diagnostic tests, administering medications, um, a therapy, a physical therapy, or an activity like out of bed or tilt the bed, or the use of durable medical equipment like a walker, wheelchair, crutches, etc. Now, because you're ordering these things for patient care, you have a very important opportunity to intervene in the process of ordering to prevent errors like medication errors, or to improve compliance with a guideline where recommendations based on a condition can be made to the ordering clinician. Orders and healthcare costs, direct correlation. Picture on the left, sort of old school prescription pad. Nowadays, what you see in clinical settings, care teams working around devices, individuals entering information into the system, and pretty much all orders are electronic. Though the maxim still exists, though we don't talk about the physician's pen anymore, but pretty much been calculated that 80% of the spend in healthcare flows from the physician's pen, so therefore through the order entry system. So whatever you do there can have a major impact on the cost and quality of healthcare. Computerized physician order entry, or CPOE. The orders are communicated electronically. Very powerful because the status, updates, results communicated back. So you order a lab test, you get back the result. You can turn around things faster. In the old days, when I trained, there was a paper requisition that came along with a specimen with a lot of manual transcription of information, very slow turnaround times. Documentation has been greatly enhanced. When I did my residency in the 80s, often there would be very small amount of documentation that came with a specimen. Now we have access to everything about the order and everything about the patient. Big impact on reducing errors in medication prescribing. We could reduce adverse drug events, drug-drug interactions, drug condition interactions, of course allergy checking. We could also make specific recommendations based on a diagnosis, that decision support, and then of course through planning we could standardize care because we intervene in the process of ordering. So I've done some screen captures to show you in Eclipsys the order entry process. Here's a simple example, ordering lab tests, and you see there's a screen, whether it's routine labs or hematology or chemistry. Here I've checked off the BMP, or the basic metabolic panel. It's also known as a Chem 7 or a SMA SMAC 7, and you can see that it's the various individual tests that go into that panel. So with one click at a specific time for a specific patient, you see the patient, the banner bar, which lists allergies, and other things about the patient, date of birth, and other identifiers. I'm able to quickly order a test. So that's simple order entry on a lab test. Here, a little bit more complicated, is order entry for a medication. You see there's a pop-up screen. I'm ordering enoxaparin, and now I'm able to enter all sorts of information if necessary, weight, dry weight, what the patient's creatinine clearance is, and things that may be important in the prescribing of this medication, though in this case it's not necessary, but clearly a little more complicated than simply ordering a lab test. You can see on the screen there's the last dose administered if the patient had already received this medication, so a lot more information. Here we have an order set. What's an order set? It's a group of orders that a team of people have designed. This is an order set for insulin drip. You see at the top of the screen, what's the diagnosis? Checking off, is it type 1, type 2 diabetes, or is the patient just hyperglycemic? I then can prescribe the actual drip, what's the dosage, how many units per hour, and there's comments along that. And then below that, I can then determine what the fluid is that will be part of the drip. And there's some pre-selected entries. So here it allows me to not have to hunt and peck and look for things, one-stop shopping to put together a rather complex order for an insulin drip. What's a clinical pathway? Well, it's more than a guideline or a protocol. It's a very, I guess you would here we call it an all-encompassing bedside document. It's a list of all the things that the patient's going to receive, and it's a best practice for most patients most of the time. So here's a very succinct definition. It's an interdisciplinary day-by-day guideline that recommends specific interventions, treatments, diagnostic testing, consultations, and even patient education at the appropriate stage along the patient's recovery. Very patient-oriented document and contains all the necessary information to care for the patient. NYP has an extensive development effort in pathways. There are physician champions, nurses, service line administrators, and they've used interdisciplinary teams to develop these pathways. They look at minutes, hours, or days for specific units. What are the expected outcomes? These are developed for very specific patient populations. It includes quality data. It talks about the beginning and end of episodes of care, and what are the key care elements that are appropriate for at a specific time and place, and then who does the specific tasks. The teams are multidisciplinary. You can see here the development of them, or the lead care providers, whether they're MDs or nurse practitioners or physician assistants, bedside nursing, social workers, nutrition, the care coordination team, patient care managers, the full range of therapists, and any other specialty that would be involved in patient care, and they go through an approval process. So here on Infonet, I did a little cut and pasting to show how you could navigate. They're in policies and procedures, then in clinical pathways, and at least as of last year, and I know this list has grown, you could see the list of clinical pathways that are available. Very recognizable conditions with large admission volumes at NYP. You could also retrieve the care pathways through an icon in Eclipsys. It's called the clinical pathway icon, and go directly to it from in Eclipsys. So what's on one of these care pathways? And I'm going to go and sort of chunk up the document. So here in the top right, this is an example of the pneumonia pathway. It's who's included. In this case, it's chest X-ray shows simple pneumonia, and it's an inpatient a minute, inpatient admission. Excluded are simple pneumonia coming from the community, or an immunosuppressed or septic or requiring admission to an ICU. So that's the inclusion-exclusion criteria. The expected length of stay, in this case it's 4 days, and then you can see columns that are the timeline. Whether in certain locations it could be minutes or hours, and in this instance in pneumonia it's a multi-day timeline. Here we see the expected patient outcomes. So what should be happening? For example, you'll see that on day 2, the oxygen saturation should be above 94% on room air. So these are guidelines that indicate where the patient should be at a specific time that gets the entire team on that timeline and agreeing as to if the patient's on target or off target. Here we see in the individual categories as we scroll down in the document by provider type, what are they doing on what days? and you'll be able to see in your document all the detail, whether it's a assessment or diagnostic test, whether it's nutrition or activities, so out of bed, things like that, what medications, treatments, and therapy. So how do you find these? How do you order them? Here we did a simple search for sepsis. It popped up the clinical pathway. This is an Eclipsys again. The clinical pathway or the clinical order set. So I picked the pathway. I then have to initiate that clinical pathway. It's a checkbox. And because many of the pathway activities are outcomes and things like that, right now in Eclipsys, it triggers an order set for that pathway. And the things that you can order come up. Then here, obviously, in a sepsis case, antibiotics with all the different ways you can order it, and it's a sort of a guideline. It's an order set embedded in the pathway. So when you initiate a pathway, the protocol is initiated, the clinical team is notified, the clinical pathway order set includes that communication, all the activities are there, all the the clinical team reviews the activities, and then they also have to understand what activities are exclusive to the pathway document. When you discontinue a pathway, you do that by using the order set or the pathway itself, and that you'll see on your pathway documents exactly what's in the pathway. So let's talk about your small group role play. We're going to use these various tools, and there'll be a pathway, but it's much more than that. And this is sort of the setup for your role play. You're working on a general medicine unit in CHONI in response to low patient satisfaction scores and readmissions and long length of stay. The hospital has decided to initiate family-centered interdisciplinary rounds, which will occur on every unit every day. You're tasked with rounding for 30 minutes each day to discuss unit patients at the bedside. You get no other instructions on how these rounds will be structured. Everyone seems a little confused and grumpy because now all of a sudden you're told to do this thing. It's new, it's extra work, you're not fully understanding how it's going to work out. And on the first day of rounds, there are lots of people present. You don't really know all the roles and who they are, and you're going to kick off your first multidisciplinary or interdisciplinary rounds. That's the setup for your first interaction with multidisciplinary rounds. There'll also be a panel presentation by different care providers who will talk about their roles in the hospital. So you'll know a little bit more about people, but you won't know too much about how to conduct a multidisciplinary round. That will be sort of mirrored in what this small group role play scenario is, and typical of what happens in institutions that decide to implement interdisciplinary rounds, and too often don't give enough instructions on how to conduct those rounds. So we're trying to recreate a scenario that you would experience today in many institutions, and then later in another class, in another exercise, we'll dive a little deeper into what's the alternative to such chaos, you could say. Anyway, I look forward to helping you through all this, and I think we'll all learn a lot. Thank you very much.